Question 1. John is a clinical documentation specialist, CDS, working in a hospital's clinical documentation improvement CDI program. He notices that a physician's progress note for patient undergoing surgery lacks documentation of the patient's hypertension, despite the patient having known history of the condition. Upon further review, John finds that the physician has documented the patient's post-surgical recovery, complications, but no mention of chronic conditions like hypertension is made. John decides to send query to the physician for clarification. Which of the following is the most appropriate action for John to take when sending the query? A. John should avoid querying the physician as it may be seen as an overstep of his role. B. John should provide detailed explanation in the query regarding the significance of hypertension in the patient's current condition. C. John should only ask whether hypertension is documented in the patient's medical record without suggesting any further documentation. D. John should suggest the physician add the diagnosis of hypertension even though it was directly observed during the patient's current visit. Answer. B. John should provide a detailed explanation in the query regarding the significance of hypertension in the patient's current condition. Explanation. In this scenario, John is following best practices for clinical documentation improvement. CI. When querying physician, it is critical to provide context for the missing diagnosis like hypertension and explain its relevance in the patient's overall clinical picture. This helps the physician understand the importance of including it in the medical record. The query should focus on the clinical significance, not just ask a yes-no question, as this promotes accurate and complete documentation. According to CMS guidelines, proper documentation must reflect all conditions affecting the patient's care and management, including chronic conditions like hypertension. Queries should aim to clarify any ambiguity and ensure the document aligns with the patient's full clinical status. Avoiding queries, option A, or suggesting documentation without clinical justification, option D, would undermine documentation quality. Option C also fails to provide enough context for the physician's understanding. Question 2. Which of the following is not a key element of the clinical documentation improvement? CI process. A. Identifying and addressing incomplete or inaccurate documentation. B. Educating physicians on the importance of accurate documentation and query responses. C. Coding diagnoses directly from physician notes without verifying them with the physician. D. Ensuring clinical documentation aligns with ICD 10 cm and ICD 10 PCS guidelines. Answer. C. Coding diagnoses directly from physician notes without verifying them with the physician. Explanation. The role of a clinical documentation specialist, CDS, is not to directly assign codes without verification. This process is the responsibility of the medical coder. While the CDS plays an integral part in ensuring the accuracy and completeness of clinical documentation, their job is to identify gaps or inaccuracies, documentation, educate healthcare providers on proper documentation practices, and query physicians for clarification. Option A, B, and D are key components of CEI best practices as they directly align with improving documentation accuracy, ensuring compliance with coding standards, and supporting reimbursement efforts. Coding without verifying diagnosis with the physician, option C, violates the principles of CEI, which emphasize collaboration between CDS, physicians, and coders to ensure documentation accurately reflects the clinical picture. Question 3, scenario-based. Maria is reviewing a patient's chart for clinical documentation improvement. The patient was diagnosed with sepsis during their hospital stay, but the physician did not include any details about the underlying cause of the sepsis. Maria knows that the underlying cause of sepsis, such as an infection, is essential for accurate coding and proper reimbursement. She considers sending a query to the physician but is unsure. Approach it. What is the most appropriate way for Maria to phrase the query? A. Can you specify if the infection was the underlying cause of the sepsis? Please include any pertinent details. B. The documentation of sepsis is insufficient. Please provide a more detailed diagnosis. C. The patient was diagnosed with sepsis but the cause is unclear. Please clarify if the infection is related to the sepsis. D. Please document that the infection caused the sepsis as this is needed for accurate coding. Answer A. Can you specify if the infection was the underlying cause of the sepsis? Please include any pertinent details. Explanation. The most appropriate query is option A, which focuses on requesting clarification from the physician regarding the underlying cause of the sepsis. In the case of sepsis, it is crucial to document the specific source or infection responsible for triggering the sepsis, as this directly affects coding accuracy. According to ICD-10 guidelines, the code for sepsis requires that the underlying infection be identified, which has implications for proper reimbursement, particularly under RG diagnosis-related group and risk adjustment models. Maria's query should be phrased in a way that encourages thorough response without leading the physician to assume or incorrectly document the cause. Option B and C are too vague, while option D suggests an assumption of the diagnosis which is not an appropriate or compliant query. Always avoid suggesting specific documentation in the query unless it's clinically supported. Question 4. During a routine clinical documentation improvement, CDI or the CERO, a clinical documentation specialist, identifies that a physician's progress note fails to document a patient's history of chronic kidney disease, CKD. The patient's medical history indicates stage 3 CKD, which impacts the patient's overall treatment plan and outcomes. Sarah knows that the presence of CKD must be documented to reflect the patient's care and to ensure proper reimbursement. Which of the following actions should Sarah take to address this documentation gap? A. Sarah should send a query to the physician asking for clarification on whether the patient has CKD, even though the condition is documented in the patient's medical history. B. Sarah should suggest that the physician add the diagnosis of CKD, regardless of the patient's current clinical status, since it is important for reimbursement. C. Sarah should provide the physician with detailed explanation regarding the importance of CKD in the patient's management and request that it be documented if clinically appropriate. D. Sarah should not query the physician because CKD is pre-existing condition and does not need to be documented again in the progress note. Answer. C. Sarah should provide the physician with a detailed explanation regarding the importance of CKD in the patient's management and request that it be documented if clinically appropriate. Explanation. Option C is the correct answer because the CDS, clinical documentation specialist, should request clarification from the physician on the clinical appropriateness of documenting CKD. The physician needs to document all conditions that have patient care, including chronic conditions like CKD, to ensure the full clinical picture is captured. Sarah should not assume the diagnosis should be added without clinical relevance, but should explain the importance of this condition in the patient's care and the impact on reimbursement. CKD significantly affects patient management, and accurate documentation aligns with ICD-10 centimeter guidelines and supports reimbursement at a diagnosis-related group systems. Option is incorrect because it does not provide enough context or clarification, and option D is incorrect because CAD must be documented when it is clinically relevant, regardless of whether it is pre-existing condition. Question 5. Mark is a clinical documentation specialist, CDS, reviewing a patient's chart. The physician has documented that the patient has pneumonia, but has not specified whether it is community-acquired pneumonia, CAP, or hospital-acquired pneumonia, HAP. Mark knows that distinguishing between these two types of pneumonia is critical for accurate coding, proper reimbursement, and patient care. What is the best course of action for Mark to take regarding this documentation issue? A. Mark should code the pneumonia as community-acquired pneumonia, CAP, assuming it's the most common type. B. Mark should query the physician to clarify whether the pneumonia is community-acquired or hospital-acquired, explaining the significance of the distinction. C. Mark should ignore the missing information because pneumonia in general is documented, and the type of pneumonia is irrelevant for coding purposes. D. Mark should change the diagnosis hospital-acquired pneumonia, HAP, based on the patient's stay in the hospital. Answer. B. Mark should query the physician to clarify whether the pneumonia is community-acquired or hospital-acquired, explaining the significance of the distinction. Explanation. The best course of action is to send a query option B to the physician requesting clarification on whether the pneumonia is community-acquired, CAP, or hospital-acquired, HAP. Distinguishing between the two is crucial for proper coding and reimbursement. According to ICD-10 guide, the distinction between CAP and HAP affects the severity of the illness and the treatment course, which can impact diagnosis-related Group G assignment and reimbursement rates. This differentiation is important for healthcare quality metrics and reimbursement under Medicare and Medicaid. Option is incorrect because Mark should not assume the type of pneumonia without physician clarification. Option C is incorrect because the distinction between CAP and HAP is critical for accurate coding and reimbursement. Option D is also incorrect because Mark should not change the diagnosis without input from the physician. Question 6. Linda, a clinical documentation specialist, CDS, is reviewing a patient's discharge summary and notices that the physician has documented acute kidney failure but has not mentioned whether the failure is stage 1, stage 2, or stage 3. Linda is aware that the stage of kidney failure has an impact on the treatment plan, prognosis, and reimbursement rates. How should Linda proceed with the documentation gap? A. Linda should leave the documentation as is because the physician has already indicated that the patient has acute kidney failure. B. Linda should query the physician to clarify the stage of acute kidney failure, explaining the significance of staging for the patient's clinical outcomes and reimbursement. C. Linda should change the documentation to stage 1 acute kidney failure, as it is the most common stage. D. Linda should not query about the staging of kidney failure because the acute diagnosis is sufficient. Answer. B. Linda should query the physician to clarify the stage of acute kidney failure, explaining the significance of staging for the patient's clinical outcomes and reimbursement. Explanation. In this case, Linda should query the physician to clarify the stage of the acute kidney failure, option B. The stage of kidney failure is critical for accurate coding, prognosis, and reimbursement. The ICD-10 coding guidelines specify that the stage of kidney failure should be documented when relevant to patient care, and the stage directly impacts both diagnosis-related group DRG assignment and the associated reimbursement rates. By querying the physician for this clarification, Linda ensures that the documentation accurately reflects the patient's condition. Option is incorrect because simply documenting acute kidney failure without the stage is incomplete for coding purposes. Option C is incorrect because Linda should not change the documentation independently but should clarify with the physician. Option D is also incorrect because the stage of kidney failure is essential to provide full clinical picture and to support accurate reimbursement. Question 7. James, a clinical documentation specialist, is reviewing a patient's record and notices that the physician has documented severe sepsis but has not specified the source of infection, which is essential for accurate coding. Sepsis codes require documentation of both the infection and the organ involved. What should James do in this situation? A. James should leave the documentation as is since the physician has already documented severe sepsis, which is sufficient for coding. B. James should send query to the physician requesting the source of infection and any associated organ involvement, explaining the importance for proper coding and reimbursement. C. James should change the diagnosis to include generic infection as the source even though it is not documented by the physician. James should not query the physician as severe sepsis is enough for DRG assignment. Answer. B. James should send a query to the physician requesting the source of infection and any associated organ involvement, explaining the importance for proper coding and reimbursement. Explanation. In this situation, James should query the physician for clarification regarding the source of infection and any associated organ involvement. Option B. According to ICD-10 guidelines, the diagnosis of sepsis must specify the source of infection, organs affected to ensure accurate coding. Severe sepsis is a high-severity diagnosis, and the documentation must reflect both the infectious source and organ systems involved to ensure proper reimbursement at a DRG assignment. Option is incorrect because the absence of a specified infection source and organ involvement makes the diagnosis incomplete for coding purposes. Option C is incorrect because James should never add a diagnosis or assume details without physician clarification. Option D is incorrect because severe sepsis alone is insufficient without further details regarding the infection source and organ involvement, which directly impact coding accuracy and reimbursement. Question 8. Rebecca is reviewing a patient's chart where the physician has documented diagnosis of diabetes mellitus but has not specified whether the diabetes is type 1 or type 2. Rebecca knows that the type of diabetes significantly impacts the patient's treatment plan, coding, and reimbursement. What should Rebecca do next? A. Rebecca should leave the documentation as is because the type of diabetes does not impact the treatment or coding. B. Rebecca should change the diagnosis to type 2 diabetes, assuming it is the most common form. C. Rebecca should send a query to the physician asking for clarification on the type of diabetes, explaining the importance of accurate documentation for coding and reimbursement. D. Rebecca should not query the physician because types of diabetes are managed in the same way. Answer. C. Rebecca should send a query to the physician asking for clarification on the type of diabetes, explaining the importance of accurate documentation for coding and reimbursement. Explanation. Rebecca should query the physician for clarification on the type of diabetes. Option C The ICE 10 centimeter coding system requires the specification of diabetes as either type 1 or type 2 for accurate diagnosis coding, which impacts treatment and reimbursement. The treatment protocols for type 1 and type 2 diabetes differ, and this distinction affects both the clinical management of the patient and the assignment of appropriate codes for reimbursement purposes. Option is incorrect because the type of diabetes is essential for accurate coding. Option B is incorrect because Rebecca should not assume the type of diabetes and should seek clarification from the physician. Option D is incorrect because the management of type 1 and type 2 diabetes differs, and coding for both types must be accurate for proper reimbursement and treatment planning. Question 9. Tom is a clinical documentation specialist reviewing a patient's record in which physician has documented depression but has not specified whether it is major depressive disorder, MDD, or another form of depressive disorder. Tom is aware that the specific type of depression is crucial for coding and reimbursement purposes. How should Tom address this documentation issue? A. Tom should code the depression as major depressive disorder, MDD, assuming it is the most common form. B. Tom should query the physician to clarify whether the depression is major depressive disorder, MDD, explaining the importance of specifying the type for coding and reimbursement. C. Tom should change the diagnosis to generalized anxiety disorder, GAD, since both conditions often present similarly. D. Tom should leave documentation as is because depression is sufficiently documented. Answer. B. Tom should query the physician to clarify whether the depression is major depressive disorder, MDD, explaining the importance of specifying the type for coding and reimbursement. Explanation. In this scenario, Tom should query the physician for clarification on whether the depression is major depressive disorder, MDD, or another type of depressive disorder. Option B. The type of depression affects the treatment approach, prognosis, and for reimbursement. According to ICD-10 coding guidelines, major depressive disorder, MDD, has specific diagnostic criteria, and the correct specification is essential for both clinical management and reimbursement. Option is incorrect because Tom should not assume the type of depression but should clarify it with the physician. Option C is incorrect because depression and generalized anxiety disorder are distinct diagnoses with different treatment and coding implications. Option D is incorrect because the specific type of depression must be documented for accurate coding and reimbursement. Question 10. Jessica, a clinical documentation specialist, is reviewing a patient's record and notices that the physician has documented chronic obstructive pulmonary disease, COPD, but has not indicated whether it is with or without acute exacerbation. Jessica understands that acute exacerbations significantly affect the patient's treatment plan, prognosis, and reimbursement. What should Jessica do next? A. Jessica should code the COPD without acute exacerbation, as the physician has not mentioned an acute event. B. Jessica should assume that the patient's COPD is in stable condition and leave the documentation as is. C. Jessica should query the physician to clarify whether the COPD is with or without acute exacerbation, explaining the importance of accurate documentation for reimbursement and clinical management. D. Jessica should not query the acute exacerbation is not a significant factor for coding COPD. Answer. C. Jessica should query the physician to clarify whether the COPD is with or without acute exacerbation, explaining the importance of accurate documentation for reimbursement and clinical management. Explanation. It is crucial to determine whether the patient's COPD is with or without acute exacerbation. This distinction impacts both treatment decisions and coding for reimbursement. Acute exacerbations of COPD are associated with higher level of and may require more intensive resources. Option C is correct as it ensures the physician clarifies this important clinical detail. Option and B are incorrect because they either assume or overlook the clinical significance of acute exacerbations in COPD. Option D is incorrect because acute exacerbation of COPD is an important factor for coding accuracy. Question 11. Sarah is reviewing a patient's hospital discharge summary. The physician has documented acute myocardial infarction, MI, but has not specified the type of MI, elevation MI, non-elevation MI, or unspecified. Sarah knows that the type of MI affects the treatment protocol and reimbursement rates. What should Sarah do to address this documentation gap? A. Sarah should code the MI as non-elevation MI and STEMI, assuming it is the most common type of MI. B. Sarah should leave the documentation as is since MI is already documented. C. Sarah should send a query to the physician requesting clarification on the type of MI, explaining the impact on coding and patient management. D. Sarah should change the diagnosis to elevation MI, STEMI, assuming it is the most critical type of MI? Answer: C. Sarah should send a query to the physician requesting clarification on the type of MI, explaining the impact on coding and patient management. Explanation: the type of myocardial infarction MI directly influences treatment options, prognosis, and coding for reimbursement. Acute MI can be classified as scintillation MI, STEMI, non-elevation MI, NSTEMI, or unspecified. The ICD-10 code for each type varies in ERG assignment and reimbursement. Sarah should query the physician to ensure the accurate type of MI is documented. Option C. Option and D are incorrect because they assume the type of MI without physician clarification. Option B is also incorrect because the type of MI is crucial for proper coding. Question 12. David, a clinical documentation specialist, is reviewing a patient's chart and notices that the physician has documented severe congestive heart failure (HF) but has not specified whether it is systolic or diastolic. David understands that the type of heart failure affects the treatment plan and reimbursement. What should David do to address this issue? A. David should assume that the heart failure is systolic and leave the documentation as is. B. David should code the CHF as diastolic heart failure as it is the most common type. C. David should send query to the physician requesting clarification on whether the CHF is systolic or diastolic, explaining the importance of accurate documentation. D. David should leave the documentation as is, as both types of heart failure treated similarly. Answer: C. David should send a query to the physician requesting clarification on whether the CHF is systolic or diastolic, explaining the importance of accurate documentation. Explanation: the type of congestive heart failure CHF, whether systolic or diastolic, is essential for accurate coding and treatment planning. Systolic and diastolic heart failure are managed differently, and accurate documentation ensures appropriate reimbursement and care. David should query the physician for clarification on this. Option C. Option and B are incorrect because they make assumptions about the type of heart failure without physician clarification. Option D is incorrect because the two types of CHF have different implications for treatment and coding. Question 13. Nina, a clinical documentation specialist, is reviewing a patient's record and sees that the physician has documented acute respiratory failure. However, the physician has not specified whether it is with or without hypoxia or hypercapnia. Nina knows that this detail is critical for accurate coding. What should Nina do? A. Nina should assume the respiratory failure is without hypoxia or hypercapnia, as these conditions are often not specified. B. Nina should code the respiratory failure as with hypoxia, as it is the most common type. C. Nina should send query to the physician to clarify whether the respiratory failure is with or without hypoxia or hypercapnia, explaining the importance for accurate coding and reimbursement. D. Nina should leave the document as is, as the details about hypoxia and hypercapnia are not necessary for coding respiratory failure. Answer: C. Nina should send a query to the physician to clarify whether the respiratory failure is with or without hypoxia or hypercapnia, explaining the importance for accurate coding and reimbursement. Explanation: the presence or absence of hypoxia or hypercapnia in acute respiratory failure is a crucial factor in determining the severity of the condition and in coding for reimbursement purposes. Nina should query the physician to obtain clarification. Option C. Option A and B are incorrect because they make assumptions without confirming the clinical details. Option D is incorrect because the absence of hypoxia or hypercapnia is a key part of accurate coding for respiratory failure. Question 14. Nora, a clinical documentation specialist, is reviewing a patient's chart where the physician has documented acute renal failure but has not indicated whether it is prerenal, intrinsic, or postrenal. Laura understands that the cause of renal failure is important for treatment planning and coding. What should Laura do next? A. Laura should assume the renal failure is prerenal and leave the documentation as is. B. Laura should code the renal failure as postrenal as it is the most common type. C. Laura should send query to the physician requesting clarification on the cause of renal failure, explaining its significance for accurate coding and patient management. D. Laura should leave the documentation as is because the cause of renal failure is not necessary for coding. Answer: C. Laura should send a query to the physician requesting clarification on the cause of renal failure, explaining its significance for accurate coding and patient management. Explanation: the cause of acute renal failure, whether prerenal, intrinsic, or postrenal, directly affects the treatment approach and the severity of the condition, which in turn impacts coding and reimbursement. Laura should query the physician to determine the exact cause. C. Option and B are incorrect because they make assumptions about the cause of renal failure without clarification. Option D is incorrect because accurate documentation of the cause is critical for coding purposes. Question 15. John is a clinical documentation specialist reviewing a patient's medical record and notices that the physician has documented stroke but has not specified whether it is ischemic or hemorrhagic. John understands that this distinction is crucial for coding and treatment decisions. What is the best course of action for John? A. John should code the stroke as ischemic, as it is the most common type of stroke. B. John should assume the stroke is hemorrhagic, as this is often a more severe type of stroke. C. John should query the physician to clarify whether the stroke is ischemic or hemorrhagic, explaining the importance for accurate coding and patient care. D. John should leave the documentation as is because the type of stroke does not affect treatment. Answer. C. John should query the physician to clarify whether the stroke is ischemic or hemorrhagic, explaining the importance for accurate coding and patient care. Explanation. The type of stroke, ischemic or hemorrhagic, has important implications for patient management, treatment decisions, and coding. Ischemic and hemorrhagic strokes have different causes, treatments, and prognoses. Therefore, John should query the physician for clarification. C. Option and B are incorrect because they make assumptions about the type of stroke without physician clarification. Option D is incorrect because the type of stroke significantly affects treatment protocols and coding. Question 16. Emily, a clinical documentation specialist, is reviewing a patient's record and notices that the physician has documented anemia but has not specified the type, e.g., iron deficiency anemia, vitamin B deficiency anemia, etc. Emily understands that the type of anemia is crucial for treatment and reimbursement. What should Emily do? A. Emily should code the anemia as iron deficiency anemia, as it is the most common type. B. Emily should assume the anemia is due to vitamin B deficiency, as this is often seen in hospitalized patients. C. Emily should send query to the physician requesting clarification on the type of anemia, explaining the importance for accurate documentation and treatment. D. Emily should leave the documentation as is because anemia is general diagnosis, does not require further specification. Answer. C. Emily should send a query to the physician requesting clarification on the type of anemia, explaining the importance for accurate documentation and treatment. Explanation. Anemia can have many underlying causes, and identifying the type, such as iron deficiency anemia or vitamin B deficiency anemia, is essential for accurate coding and treatment. Emily should query the physician for clarification. Option C. Option A and B are incorrect because they make assumptions about the type of anemia without confirmation. Option D is incorrect because specifying the type of anemia is necessary for coding accuracy and proper treatment. Question 17. Jacob, a clinical documentation specialist, is reviewing a patient's medical record. The physician has documented acute pancreatitis but has not specified whether it is mild, moderate, or severe. Jacob knows that the severity of pancreatitis impacts both treatment and reimbursement. What should Jacob do to resolve this issue? A. Jacob should assume that pancreatitis is mild and leave the documentation as is. B. Jacob should code the pancreatitis as severe, as it is the most critical type. C. Jacob should send a query to the physician requesting clarification on the severity of the pancreatitis, explaining the impact on treatment and reimbursement. D. Jacob should leave the documentation as is because the severity is not critical for coding. Answer. C. Jacob should send a query to the physician requesting clarification on the severity of the pancreatitis, explaining the impact on treatment and reimbursement. Explanation. The severity of acute pancreatitis, mild, moderate, or severe, is important for treatment planning, prognosis, and reimbursement. Jacob should query the physician to clarify the severity. Option C. Option A and B are incorrect because they make assumptions without clinical confirmation. Option D is incorrect because the severity of the condition is critical for accurate coding and reimbursement. Question 18. Sophia, a clinical documentation specialist, is reviewing a patient's chart where the physician has documented chronic liver disease but has not specified whether it is cirrhosis or another form of liver disease. Sophia understands that cirrhosis has different implications for treatment, prognosis, and coding. What should Sophia do next? A. Sophia should assume the liver disease is cirrhosis and leave the documentation as is. B. Sophia should send query to the physician requesting clarification on whether the liver disease is cirrhosis, explaining its significance for coding and patient care. C. Sophia should change the diagnosis to cirrhosis based on the patient's medical history. D. Sophia should leave the documentation as is because the form of liver disease does not impact coding. Answer. B. Sophia should send a query to the physician requesting clarification on whether the liver disease is cirrhosis, explaining its significance for coding and patient care. Explanation. Cirrhosis is a specific type of chronic liver disease with distinct treatment and coding implications. Sophia should query the physician to clarify whether the liver disease is cirrhosis. Option B. Option O and C are incorrect because Sophia should not assume or change the diagnosis without physician input. Option D is incorrect because cirrhosis has significant implications for both clinical management and coding. Question 19. Liam, a clinical documentation specialist, is reviewing a patient's medical record. The physician has documented acute gastritis but has not specified whether it is erosive or non-erosive. Liam knows that this distinction is important for treatment and coding purposes. What should Liam do to address this? A. Liam should assume the gastritis is non-erosive and leave the documentation as is. B. Liam should code the gastritis as erosive, assuming it is the more severe form. C. Liam should send a query to the physician requesting clarification on whether the gastritis is erosive or non-erosive, explaining the significance for accurate coding and patient care. D. Liam should leave the documentation as is because the type of gastritis is not necessary. Coding. Answer. C. Liam should send a query to the physician requesting clarification on whether the gastritis is erosive or non-erosive, explaining the significance for accurate coding and patient care. Explanation. The type of gastritis, erosive or non-erosive, can impact the treatment plan, severity, and coding for reimbursement. Erosive gastritis is associated with higher level of severity and requires more intensive treatment. Liam should query physician for clarification. Option C. Option and B are incorrect because they make assumptions without clinical confirmation. Option D is incorrect because the type of gastritis is crucial for coding and clinical management. Question 20. Karen, a clinical documentation specialist, is reviewing a patient's record. The physician has documented diabetic nephropathy but has not indicated whether it is with or without renal failure. Karen understands that this detail is essential for determining the patient's prognosis and for reimbursement purposes. What should Karen do? A. Karen should assume the nephropathy is without renal failure and leave the documentation as is. B. Karen should code the nephropathy as with renal failure, as it is the more severe form. C. Karen should send a query to the physician requesting clarification on whether the nephropathy is with or without renal failure, explaining its significance for accurate coding. D. Karen should leave the documentation as is because the presence of renal failure is necessary for coding diabetic nephropathy. Answer. C. Karen should send a query to the physician requesting clarification on whether the nephropathy is with or without renal failure, explaining its significance for accurate coding. Explanation. The presence of renal failure in diabetic nephropathy affects both the clinical management and reimbursement levels. Accurate documentation is crucial for assigning the correct Type 10 code. Karen should query the physician to clarify this important aspect. Option C. Option O and B are incorrect because they assume the condition's severity without confirmation. Option D is incorrect because renal failure is an essential component in coding and treatment. Question 21. Matthew, a clinical documentation specialist, is reviewing a patient's record and sees that the physician has documented acute appendicitis but has not specified whether it is perforated or non-perforated. Matthew understands that this distinction significantly impacts both the treatment and reimbursement. What should Matthew do? A. Matthew should assume the appendicitis is non-perforated and leave the documentation as is. B. Matthew should code the appendicitis as perforated, as it is the more complicated type. C. Matthew should send query to the physician requesting clarification on whether the appendicitis is perforated or non-perforated, explaining the importance for accurate coding. D. Matthew should leave the documentation as is because the type of appendicitis is necessary for coding. Answer. C. Matthew should send A query to the physician requesting clarification on whether the appendicitis is perforated or non-perforated, explaining the importance for accurate coding. Explanation: the distinction between perforated and non-perforated appendicitis significantly affects treatment protocols, the clinical course, and reimbursement. Matthew should query the physician to obtain this clarification. Option C. Option A and B are incorrect because they make assumptions about the condition without confirmation from the physician. Option D is incorrect because the type of appendicitis is important for accurate coding in clinical management. Question 22. Lily, a clinical documentation specialist, is reviewing a patient's record and sees that the physician has documented sepsis but has not specified the source of infection, e.g., urinary, respiratory, gastrointestinal. Lily knows that the source of infection is critical for coding and treatment decisions. What should Lily do? A. Lily should assume the source of the infection is respiratory and leave the documentation as is. B. Lily should code the sepsis as originating from the urinary tract as it is the most common source. C. Lily should send query to the physician requesting clarification on the source of infection, explaining its impact on coding and patient care. D. Lily should leave the documentation as is because the source of infection is not necessary for coding sepsis. Answer: C. Lily should send a query to the physician requesting clarification on the source of infection, explaining its impact on coding and patient care. Explanation: the source of infection in sepsis is critical for accurate coding and treatment planning. Different sources, e.g., urinary, respiratory, gastrointestinal, require different management strategies and may affect reimbursement. Lily should query the physician to clarify the infections. Option C. Option A and B are incorrect because they make assumptions without clarification. Option D is incorrect because the source of infection is necessary for accurate coding in clinical management. Question 23. Oscar, a clinical documentation specialist, is reviewing a patient's record and sees that the physician has documented chronic kidney disease but has not indicated the stage, e.g., stage 1, stage 2, etc. Oscar understands that the stage of kidney disease significantly impacts treatment and reimbursement. What should Oscar do? A. Oscar should assume the kidney disease is stage 3 and leave the documentation as is. B. Oscar should code the kidney disease as stage 5, as it is the most severe stage. C. Oscar should send query to the physician requesting clarification on the stage of kidney disease, explaining its importance for accurate coding and patient care. D. Oscar should leave the documentation as is because the stage of kidney disease is not critical for coding. Answer: C. Oscar should send a query to the physician requesting clarification on the stage of kidney disease, explaining its importance for accurate coding and patient care. Explanation: the stage of chronic kidney disease, CKD, is essential for both treatment planning and reimbursement as each stage requires different management strategies and levels of care. Oscar should query the physician to clarify the stage. Option C. Option A and B are incorrect because they assume the stage without clinical confirmation. Option D is incorrect because the stage of kidney disease significantly impacts coding accuracy and treatment protocols. Question 24. Jenna, a clinical documentation specialist, is reviewing a patient's chart and sees that the physician has documented acute respiratory distress syndrome, ARDS, but has not specified the severity, e.g., mild, moderate, or severe. Jenna knows that the severity of ARDS affects the treatment plan and reimbursement. What should Jenna do? A. Jenna should assume the ARDS is mild and leave the documentation as is. B. Jenna should code the ARDS as severe, as it is the most critical type. C. Jenna should send a query to the physician requesting clarification on the severity of the ARDS, explaining the importance for accurate coding. D. Jenna should leave the documentation as is because the severity of ARDS does not impact treatment. Answer: C. Jenna should send a query to the physician requesting clarification on the severity of the ARDS, explaining the importance for accurate coding. Explanation: the severity of acute respiratory distress syndrome, ARDS, is critical for both treatment and reimbursement as different severities require different management strategies. Jenna should query the physician to obtain this clarification. Option C. Option A and B are incorrect because they assume the severity without physician clarification. Option D is incorrect because the severity of ARDS directly influences treatment protocols and coding. Question 25. Ethan, a clinical documentation specialist, is reviewing a patient's medical record. The physician has documented acute osteomyelitis but has not indicated whether it is caused by a specified organism or if it is of unspecified etiology. Ethan understands that identifying the causative organism is important for both treatment and coding. What should Ethan do? A. Ethan should assume the osteomyelitis is caused by Staphylococcus aureus and leave the documentation as is. B. Ethan should code the osteomyelitis as of unspecified etiology, as the causative organism is often not specified. C. Ethan should send a query to the physician requesting clarification on the causative organism, explaining its significance for accurate coding and treatment. D. Ethan should leave the documentation as is. The organism is not always specified in osteomyelitis cases. Answer. C. Ethan should send a query to the physician requesting clarification on the causative organism, explaining its significance for accurate coding and treatment. Explanation. Identifying the causative organism in osteomyelitis is critical for accurate coding, treatment, and reimbursement. The specific organism can change the course of treatment and the appropriate antibiotics used. Ethan should query the physician to clarify the organism. Option C. Option A and B are incorrect because they assume an organism without physician confirmation. Option D is incorrect because while the organism may not always be specified, it is crucial for accurate coding in this case. Question 26. Lily, a clinical documentation specialist, is reviewing a patient's medical record and finds that the physician has documented heart failure. However, there is no mention of whether it is acute or chronic, and the severity e.g. mild, moderate, or severe is not specified. Lily knows that both the acuity and severity are critical for accurate coding and treatment planning. What should Lily do? A. Lily should assume the heart failure is chronic and moderate and leave the documentation as is. B. Lily should code the heart failure as acute and severe, as it is the most common presentation. C. Lily should send a query to the physician requesting clarification on the acuity and severity of the heart failure, explaining its significance for accurate coding. D. Lily should leave the documentation as is because heart failure does not always refer the specification. Answer. C. Lily should send a query to the physician requesting clarification on the acuity and severity of the heart failure, explaining its significance for accurate coding. Explanation. Acuity and severity are critical factors in coding heart failure as they affect both clinical management and reimbursement. Lily should clarify whether the heart failure is acute or chronic and whether it is mild, moderate, or severe to ensure accurate documentation. Coding. Option C. Option A and B assume specifics without confirmation. Option D is incorrect because heart failure requires clear documentation for appropriate coding and treatment. Question 27. Karen, a clinical documentation specialist, is reviewing a patient's chart. The physician has documented acute myocardial infarction but has not specified the type e.g. STEMI or NSTEMI. Karen understands that the type of myocardial infarction significantly impacts treatment and coding. What should Karen do? A. Karen should assume the myocardial infarction is STEMI and leave the documentation as is. B. Karen should code the myocardial infarction as NSTEMI as it is the more common form. C. Karen should send a query to the physician requesting clarification on whether the myocardial infarction is STEMI or NSTEMI, explaining the importance for accurate coding and treatment. D. Karen should leave the documentation as is because the type of myocardial infarction is not crucial for coding. Answer. C. Karen should send a query to the physician requesting clarification on whether the myocardial infarction is STEMI or NSTEMI, explaining the importance for accurate coding and treatment. Explanation. The type of myocardial infarction, STEMI or NSTEMI, influences treatment decisions, including the need for specific medications and interventions as well as reimbursement. Karen should query the physician to clarify the type of infarction. Option C. Option A and B are incorrect because they make assumptions about the condition. Option D is incorrect because the type of infarction is critical for accurate coding in clinical management. Question 28. Oscar, a clinical documentation specialist, is reviewing a patient's chart where the physician has documented pneumonia. However, there is no indication of whether it is community-acquired or hospital-acquired. Oscar knows that this distinction is important for both treatment planning and coding purposes. What should Oscar do? A. Oscar should assume the pneumonia is community-acquired and leave the documentation as is. B. Oscar should code the pneumonia as hospital-acquired as it is more common in hospitalized patients. C. Oscar should send a query to the physician requesting clarification on whether the pneumonia is community-acquired or hospital-acquired, explaining the significance for accurate coding. D. Oscar should leave the documentation as is because the distinction between community-acquired and hospital-acquired pneumonia is not important for coding. Answer. C. Oscar should send A query to the physician requesting clarification on whether the pneumonia is community-acquired or hospital-acquired, explaining the significance for accurate coding. Explanation. The type of pneumonia, community-acquired or hospital-acquired, impacts both the clinical management and reimbursement levels. Hospital-acquired pneumonia requires different treatment approaches and can result in different reimbursement rates. OSCA should query the physician to clarify this distinction. Option C. Option A and B are incorrect because they assume the cause without clarification. Option D is incorrect because this distinction is crucial for proper coding. Question 29. Matthew, a clinical documentation specialist, is reviewing a patient's record. The physician has documented stroke but has not indicated whether it is ischemic or hemorrhagic. Matthew knows that identifying the type of stroke is essential for accurate coding and treatment. What should Matthew do? A. Matthew should assume the stroke is ischemic and leave the documentation as is. B. Matthew should code the stroke as hemorrhagic as it is a more severe condition. C. Matthew should send a query to the physician requesting clarification on whether the stroke is ischemic or hemorrhagic, explaining the importance for accurate coding. D. Matthew should leave the documentation as is because the type of stroke is not necessary for coding. Answer. C. Matthew should send a query to the physician requesting clarification on whether the stroke is ischemic or hemorrhagic, explaining the importance for accurate coding. Explanation. The type of stroke, ischemic or hemorrhagic, is critical for both treatment decisions and reimbursement. These two types of stroke require different medical interventions and have different coding implications. Matthew should query the physician to clarify the type of Option C. Option A and B are incorrect because they assume specifics without confirmation. Option D is incorrect because the type of stroke is essential for both coding and clinical management. Question 30. Ethan, a clinical documentation specialist, is reviewing a patient's record and sees that the physician has documented severe asthma. However, the physician has not indicated whether the asthma is exacerbated or in a stable state. Ethan understands that exacerbations of asthma require more intensive treatment and coding. What should Ethan do? A. Ethan should assume the asthma is in an exacerbated state and leave the documentation as is. B. Ethan should code the asthma as stable, as this is the most common presentation. C. Ethan should send a query to the physician requesting clarification on whether the asthma is exacerbated or stable, explaining the importance for accurate coding and patient care. D. Ethan should leave the documentation as is because the asthma status is not necessary for coding. Answer. C. Ethan should send a query to the physician requesting clarification on whether the asthma is exacerbated or stable, explaining the importance for accurate coding and patient care. Explanation. The severity and status, exacerbated or stable, of asthma directly affect both treatment plans and reimbursement levels. Exacerbations of asthma often require additional interventions and can impact the patient's length of stay. Ethan should query the physician for clarification. Option C. Option and B are incorrect because they assume the status of the asthma without physician clarification. Option D is incorrect because the status of asthma is critical for accurate coding and clinical management.